But roughly 1 in every 3 Americans is at risk of developing a serious condition called CKD, or chronic kidney disease. This silent disease it often doesn't present any symptoms in its early stages, resulting in as many as 90% of people not even knowing that they have it. Here to talk more about the importance of early detection of CKD is Bridgette Chandler, Fresenius Kidney Care. She is a home therapy nurse and also a kidney transplant recipient. Thank you so much for joining me today.
Thank you for having me.
Now, first, let us know more about CKD. Tell us exactly what it is and how does it affect the body?
Well, CKD, or chronic kidney disease, is where gradually over time, this is a progressive disease, gradually over time, the kidneys stop functioning. They stop filtering out toxins. Oftentimes you'll see high blood pressure and that sort of things. That's how you know they have symptoms.
Now, why is it that people usually don't even know that they have chronic kidney disease? And tell us who's at risk of developing it.
Well, again, it's because this is a progressive disease. Oftentimes, patients don't ever see signs or symptoms until they're in the later stages. Nearly 15% of adults in the United States actually have chronic kidney disease and they don't even know it. Some of the causes that we look for are diabetes, high blood pressure, and really anyone over the age of 60 should be screened.
Now, what can people do if what can they do with their healthcare provider to kind of test for chronic kidney disease? What type of questions should they be asking at their doctor's office?
Well, really, you're looking for a simple blood and urine screening. It doesn't take very long. You really want to communicate with your physician. Follow up on your lab work if you have any questions.
And then if there is a diagnosis, tell us what type of steps should people take from there?
Well, in the beginning stages of CKD, it's very important that you work with your doctor to come up with a good diet and exercise plan. You can often slow down the progression of this disease. Once you're in the later stages, really the only options that you have are transplant and dialysis, such as home dialysis.
Now, Bridgette, you have firsthand experience with all of the treatment options. Tell us about your diagnosis story and how you ultimately got a kidney transplant yourself.
Well, at the age of 25, I was diagnosed with end-stage kidney failure. I was actually in nursing school at the time, and all of a sudden I find myself being the patient instead of the caregiver. I had these incredible nurses that came in and really taught me about all of my options, all the things that I didn't realize with dialysis. One of them spoke to me about home, and I was actually able to do home dialysis over 5 years while I waited for a transplant, and that kept me healthy enough that when the time came, I was able to get that transplant. And then as soon as I got it, I knew exactly what I wanted to do. I wanted to work with patients that had the same condition that I have.
That's very inspiring. Thank you for sharing your story with us and for being an advocate for others. Now, what message do you have for people who may be at risk for CKD or even facing the disease right now?
Well, ultimately, I do want to raise awareness. I'm here with Fresenius Kidney Care, of course, to present detection and prevention. Again, as I said, a simple blood test and urine screening in your doctor's office can really tell you a lot about the function of your kidneys. I also want people to understand that just because you're facing dialysis, you have options. It doesn't have to be in center. It can also be home, which creates a little more flexibility for patients. It allows them to work and travel.
That's great advice there. Now tell us, for people to learn more about CKD, especially screening and treatment options, what resources are available to them?
Well, if you have any questions, you can also always go to freseniuskidneycare.com, or you can also reach out to the National Kidney Foundation.
Perfect. Thank you so much. And again, that's freseniuskidneycare.com. Or you can also visit the National Kidney Foundation's website. They have lots of resources and information there for you, as well as go ahead and get that conversation started with your healthcare provider if you feel you need to be screened for CKD. Thank you so much again for joining me today. It's been a pleasure, and best of luck to you.
Thank you for having me.